Hello everyone, this is Dr.Aditya Sai. Welcome to our channel, the Shoulder and Knee Clinic, where we discuss about pertinent shoulder and knee issues, sports injuries, and how we treat them. So, a very important topic when people are dislocating their shoulders and the disease process is too advanced, what do we do? So, typically, when somebody has had multiple dislocations of the shoulder, there is bone wear on the socket or the glenoid, and obviously on the humeral head of the ball there is a defect known as a Hill Sachs. So depending on the severity of these two issues, further treatment is decided. So when we have somebody having a glenoid loss, bone loss, when we have somebody having a glenoid bone loss of around less than 10%, 10 to 20%, more than 20%, then it is managed differently. And we'll discuss what are the treatment options. So, when we look at bone loss which is less than 10%, generally an arthroscopic surgery where the ligaments are repaired, that is adequate to give you a very good result. However, there is a new concept that has evolved of subcritical bone loss, where the bone loss is between 10 to 20%. So that means that the shoulder has dislocated quite frequently. There is already erosion of the bone on the glenoid, and that can pose problems. So when we look at younger individuals, especially more athletic ones who like to play sports, if there is somebody who is having, let's say, a 16% bone loss on the glenoid, we just do a ligament repair surgery. There are very good chances it will work, but there are also chances that it may not work. So our purpose of treatment is that there should be no recurrence. We try to minimize the risk of recurrence. So that is where these concepts have evolved to, give you a best outcome. So in these scenarios, there is a procedure known as a bone block cerclage which we can do. Then obviously there is treatment for bone loss which is more than 20%. So in that scenario, we can do a bone block cerclage or we can do a Latarjet procedure. So today we are going to examine both these options, which one is better, which one you should consider if you have such a significant issue in your shoulder. So coming to a scenario where somebody has around 10 to 20% bone loss, there is a significant depression on the humeral head or the Hill Sachs lesion. In that scenario, what is done? So previously, people just used to do a soft tissue repair where the ligaments were repaired, and probably a remplissage where the bone defect on the humeral head is addressed. So essentially a muscle is stuck into that defect so that it no longer engages, typically when you take your hand in this position. This philosophy works very well, especially for low demand individuals who are doing a desk job and stuff like that. However, if you look at even recreational athletes, there is a higher risk of recurrence with this approach. So what we do in these scenarios is a process known as bone block cerclage. So essentially, from your shoulder blade or from around your hip joint, we take a small piece of bone graft, and we use that to augment the glenoid. So essentially this is a metal flip cerclage process where with the help of very high tensile sutures we are able to oppose the bone graft to the glenoid. We create an area of the glenoid where healing can happen, and then these two surfaces are opposed with each other so that eventually over a period of time that bone fuses with the glenoid, restores the normal anatomy. In addition to that, we do a ligament repair as well as we address the bone defect on the back or the remplissage procedure. So the advantage of doing this procedure is it's a fully arthroscopic procedure. You can be discharged the next day of the procedure and pain is minimal, and we are not altering the anatomy of the shoulder. So there is one big advantage over the Latarjet procedure where we tend to alter the anatomy of the shoulder. In the Latarjet procedure, what is done is the coracoid or the bone here is taken from here along with the attached muscle and attached on the front of the glenoid. So essentially that restores the glenoid bone loss and makes it normal or better than normal. In addition to that, the attached muscles provide a sling-like effect. So when you take your hand out in this position, It resists the anterior dislocating forces of the shoulder. So obviously Latarjet procedure is good, and especially when there is significant bone defects present in the glenoid. However, for a 10 to 20% defect, this procedure is more than adequate. The other advantage it gives over Latarjet is that there is no metal, no screws, so it is better. The risk of complications with this procedure are far less compared to a Latarjet procedure. Now, in a Latarjet procedure, even though it's a very good procedure, you need to understand it has a higher risk of complications. So, the reported risk of complications associated with the Latarjet procedure is around 25%. So, it may be that the individuals may develop something from a very minor issue to a more significant issue, but it is a procedure associated with a higher complication rate. It's not a bad procedure. What we need to just understand is, since we are dealing with a very, very complicated problem at that stage when a Latarjet is being done, so we are changing the anatomy of the shoulder, so there is a higher risk of complications associated with the Latarjet procedure. So one of the procedures which can be done is a bone block cerclage, which can restore the anatomy of the shoulder and give a good long-term result. The other procedure which can be considered, especially in bone loss which is more than 20%, is a Latarjet procedure. As we discussed previously, the coracoid is taken from here, and through a split in this tendon in the front of the subscapularis, it is attached to the glenoid nerve. So this restores the normal glenoid bone area and gives deterrence against the shoulder dislocating again. Now, what is a Latarjet procedure? The details of it we will definitely discuss in later videos. This video was more about a bone block cerclage procedure. We'll be following up this video with arthroscopic procedure of a bone block cerclage, so you can understand it better. Thanks for watching. If you like our content, do share, like and subscribe to our channel.